Okay, welcome back. And that short break, and now we have Louis on the phone. Louis, are you there?
I'm here, Doc. Listen, I got a question now. Uh, I know several people in their 50s and 60s that have gotten heart attacks. Matter of fact, a good friend of mine died from a heart attack and a stroke, and he was only 72. How dangerous is this stress, and how do we, fight this? I mean, it seems like men in their 50s and 60s are dying from these heart attacks. So what can we do to prevent that? That's my question, okay?
Okay, Louis, thanks. That's a good question and probably a topic for several shows. But suffice to say, it's the silent heart attacks that usually kill people. When people are having chest pain, they usually, hopefully, go see a doctor because everybody uh, that I know usually knows that chest pain equates with the possibility of a heart attack. Um, and it's those 50-year-old people or 60-year-old people who smoke. It's all about risk behavior and genetics. Does someone die in your family in the 50s with heart disease? Then you're at pretty good risk. If you have high blood pressure that's untreated, if you smoke, if you basically do things that are associated with an increased risk for heart disease, then you probably do have some form of heart disease. The biggest thing you can do is go see your physician and you can discuss your risk factors, get a routine checkup, look at cholesterol, look at risk for diabetes. As I've talked on the show numerous times, diabetes or high elevated blood sugar or even being a little overweight is probably one of the huge risk factors for development of heart disease because of what a high sugar level does to our cholesterol. It causes it to be chopped up into very small particles. And I tell my patients this all the time. When we check your cholesterol, it's like we get a number, and that number is basically doesn't really mean much until you peel away the layers. If our arterial system is the freeway of our circulation, and cars basically are what we call the lipoproteins. They are the carriers, and the passengers are the cholesterol molecules. Then when we check your cholesterol, all we're looking at is the number of passengers in the car. We're not looking at the number of cars that are carrying the passengers. And why that becomes important is that when your sugar becomes elevated, what it's doing is it's chopping your Lincolns into Fiats. And when you run it around with a bunch of Fiats and you have to have the same number of cholesterol particles, your freeway is very crowded. And that causes a higher risk for those particles to hit the cellular structures of our arterioles and our arteries and deposit their cholesterol into those tissues. That being said, eating a diet that's low in sugar, and everybody used to worry about cholesterol, but cholesterol is not the issue. I've talked about this on the show before. 25% of most of the cholesterol we eat gets absorbed in our body, and it again has to sit in the lipoproteins. It's the saturated fat, and it's the sugar which drives our cholesterol elevated. So basically, if you have risk factors, you need to talk to your doctor. You need to talk to your healthcare provider, and you need to make sure that you are being checked out. The ones that are the widow makers and the people that don't have any symptoms are these unfortunate percentage occlusion vessels. I mean, if your coronary artery is 70 or 60% occluded, you may not feel it because your heart will only feel it if it's low on oxygen. But if you have a lipid-rich plaque in a small artery and it becomes stressed and it basically pops like a pimple out the side, it aggravates the tissues and causes a clotting cascade, and therefore, boom, it clots off and your blood flow to your heart from that point behind it is shut down and you'll develop a heart attack. If it's high enough in the coronary artery, it will be a massive event and wipe out a lot of your heart, and it will go into fibrillation and stop. So it is important that you analyze, be honest with yourself, and analyze your risk behavior, analyze what your family history is, and do something about it. That's the way you prevent it. I hope that answered your question. Getting into your doctor is probably the answer, the biggest thing. So back to what we were talking about before the break, which was the colon cancer risk. And again, I was describing a little bit about stage 4 cancer being through the wall. Hopefully you never get to that point. And that you do get your colonoscopy. They are done here in Pahrump. But even if you don't want to do that, there's no excuse for you not going to your doctor and getting the little fecal cards. You don't even have to do anything. You just have to mail them in. And that's the way you want to do it. Ray, I was hoping you were going to call in. Ray?
Yeah, Doc, it's Flagman here. How you doing tonight?
Good. How are you?
I just heard yesterday, I have 2 phone calls about something being done in the UK about skin cancer. Mm-hmm. And it's called genetic modified herpes virus. And it's injected, supposedly, it not only does away with the skin cancer, but it also helps different cancers in the body because destroy different cancers because the body's immune system is perked up. It's supposed to be available in the States in about 1 year. I don't know why it takes so long if they got something that's actually working to take so long to get it to the people who really need it. And it's effective in even stage 4 cancers.
Wow.
You aware of this, or have you heard about it? It's only on the news about 3 or 4 days now.
No, I've not heard about that, but you've sparked my interest, and I will try and do some educating myself on that particular subject. But it fits in line with the way that we're actually going to cure cancer is to genetically modify it and target those cells that are cancerous and figure out some way to direct our immune system direct at that cancer, and that's where the deficit lies. Again, we form cancers all day long in our body. It's our immune system that has to kill them, and cancer chemotherapy as we know it today is barbaric because we have to destroy good tissue and bad tissue at the same time. I have to give you a chemotherapeutic agent that only attacks those rapidly dividing cells, but there are other rapidly dividing cells in our body. Our hair follicles, our bone marrow, and those tissues, our gastrointestinal tract, are always dividing. So therefore, we're killing that division mechanism. We're also killing our white blood cells and our immune system, which keep us healthy. And when we're doing that, we're trying to kill the cancer too. So chemotherapy by nature has its problems and drawbacks because there are resistant. I mean, if I treat you for antibiotic pneumonia, and I treat you often enough with antibiotics, I'm going to create a resistant, or I'm going to select for a resistant bacteria. And that's exactly what happens with cancer chemotherapy. We select you for those resistant cancer cells. We give you this therapy, and then we come back with this one and the next one. And we're only killing 90% of the tissues, and then we come back and the 10% are allowed to grow, and they're resistant to that chemotherapy. So therefore, we now have this resistant tumor that has developed, and if it's far spread, that continues to grow. So there's a lot of deficits in our current cancer chemotherapy. And your mention about the money, well, yeah, the FDA and whoever gets this product or whatever it is, I will tell you that in Europe, there is a reporting issue. There is no malpractice in Europe. People don't sue doctors, so a lot of stuff just goes unreported, and that's why some drugs that are developed in Europe and used extensively in Europe come to the United States, and guess what? Problems have developed. Which I'm going to digress because you know, one of the patients came in today and was talking to me about a medication that he didn't want to take because he was seeing the lawsuits on the TV. And what I heard the other day from a drug representative, which made sense, and this is the first time I ever heard that, was that all of these lawyer advertisements that you hear on the TVs, these drug companies have finally gotten smart. Rather than have a drug that's out there that has nothing bad and develop for something to happen, they just create a pool of money out there. And so it's just the cost of doing business. Why do you think pharmaceuticals have become so expensive? If they have to take 30 million or 50 million or 100 million and put it in a pool, and they leave it out there for the attorneys to just basically call in and say, you got this case. That's what they're advertising. You know, if you had known someone who took this product and bled and had this income, then you call, you might be entitled to a cash settlement. And, you know, that way the drug companies don't even have to litigate each individual case. They just award a cash award to this particular product and they move on down the road. So if you're setting up that kind of endowment fund or that kind of lawsuit fund, trust me, it's not cheap, and that's why the cost of pharmaceuticals is much greater than the cost of going to the doctor. But that was a digression of a fact. Well, I don't know if it's a fact, but what I heard, and it certainly made sense based on the TV commercials that I listened to all the time about, and it's really confusing for you, the patient, because you'll see this one drug being advertised, they'll list all the complications, and then they'll have another drug. If you've had these complications, call this lawyer. The TV stations love it. They're making a mint off of all the advertising time, but what a screwed up system. So Europe basically doesn't report a lot of the problems that people have with that, so there has to be some investigational studies over here, I'm sure, to make sure that it's safety. And anytime you start messing with genetics and you're messing with things of that nature, you want to be sure you know what you're doing, because the outcome could be horrible. Okay, we're going to take a break, and we'll be right back to discuss colon cancer and diverticulosis. Thank you.